WFNC.
Well, News Talk 640 WFNC. If you're watching us on our Facebook page or my YouTube page, you see a picture of Nicole Ryan, who is involved with marketing for the Care Clinic here in Fayetteville. We appreciate having you in here. We've been talking for the past 10 minutes or so about the 29th annual Week of Care dinners that's going to be going on now. And the most important reason, the reason we're having this right now, Nicole, is the fact that you can start buying these dinners this coming Friday.
Friday the 2nd.
Give
correct.
people a background on this, because some folks got in their car just now and just saying, hey, what's this all about?
Yes, so you have the opportunity to buy a meal for $175, and it feeds up to 6 people. It's family style, and the options come from either Luigi's Italian Chop House and Bar or Dorothy's Catering too, and it's one of our larger fundraisers for the Care Clinic.
Right, and you say $175. We will point out that's for 6, and it comes from 2 just fantastic restaurants and supporters of the Care Clinic, and
Yes.
they are?
Luigi's Italian Chop House and Bar and Dorothy's Catering too.
And we were talking a few seconds ago about what these meals are, and there's a little variety. This is not spaghetti and meatballs.
From Luigi's, one of them actually is spaghetti.
And that's
with
a good
meat
one,
sauce, but
yes.
It's a good one. It's family style, and that includes the salad and bread. The other option is family style chicken marsala, which includes green beans, mashed potatoes, and bread. And then the other 3 options are from Dorothy's. That's a meat lasagna, chicken and spinach lasagna, and vegetarian lasagna. And those all come with salad, bread, and dessert. For 6 people.
And so the schedule starts right now, but when will people be able to pick up the meals, and how does that all work?
Meal pickups will run Sunday, February 1st through Saturday, February 7th. The order window opens this Friday the 2nd and goes until the 28th. The one limitation is with Luigi's, there is a limit of 1 meal option per time slot per day. So
Yeah.
you want to get those in there. It's basically, it's going to be a max of 10 of each for each time slot. This way they're not overburdened with packaging, because everything is all set for you to go when you show up.
Oh, okay, I see. Yeah.
So they box everything up, they label it up, and then volunteers from the clinic
And
will help with that.
In addition, they still have their regular operation going on.
Yep.
I think that's
So
the
we
thing we
want
got
it
to
to
point
run
out.
very smoothly. So again, there's 10 per each time slot per item per day for Luigi's, and that's the dinner option or lunch option.
And Nicole, again, we were talking before more people got in their car or started joining our cast here, our podcast, about the fact that this money is used for a variety of things. For folks who are unfamiliar with the Care Clinic, give us that little backdrop on what they do.
Yep, we offer basic medical care and basic dental extractions for uninsured adults in Cumberland and all 6 surrounding counties. We also have specialty services, chronic care for diabetes, and in-house pharmacy. You can also have lab ordered tests, x-rays, and further education for nutrition.
Now, when you say uninsured, what does that mean specifically?
Literally, you can't have any sort of insurance. That's no Medicaid, no Medicare, or anything like that. It's really aiming towards lower income uninsured adults. It is also based on household income. So even if maybe you're in a tricky situation or you're not working and someone's helping you out with that, you could just provide a letter stating that.
And so, what about if someone who has insurance but has kids? Is this for adults or for
Adults
kids
only.
This is adults only.
Yep.
And what kind of numbers are you doing in terms of how many people you see?
Fiscal year 2024, 2025, we saw there were over 1,000 primary care visits alone. So.
Wow.
And for the fact that the clinics are only Tuesday, Thursday, and 2nd and 4th Wednesday, those are pretty good numbers.
What's the anticipation with the Affordable Care Act looking to get ready to
I
get
assume
the X?
we'll see an influx of patients, which means we need an influx of donors and volunteers to keep the doors open, literally.
Mm-hmm. So this is is this the biggest fundraiser for you?
Not biggest, it's up there though.
It's
Like
one.
I said, Giving Tuesday preliminary numbers are pretty high from Giving Tuesday 2025, and again, we were fortunate to partner with the Cumberland Community Foundation.
You know, we were talking during the break a little bit about giving, and in fact, you're from New York, and now you're involved here in this market. New York is not like the number 1 TV market. This is like 20 something, so it's a smaller. How's the adjustment been for you being here?
I like it down here a lot. We've actually been here almost 3 years, but I've been with the Care Clinic almost about a year.
Yeah, and so you're reaching out and calling folks and saying, hey, we need some help. Calling radio stations, see if you can get on. I'd say, no, I don't want you on here. No, that's not happening. Anytime you call, just about, we've been able
No,
to
you guys have
to
been
come.
very great with us,
Yeah.
especially our last. This is the third event I've spoken about with you guys, so I'm
Well,
grateful for that.
we're trying to make sure that you have access to microphones to get the word out of the folks about what it is that you're doing. I asked you last hour there, last 15 minutes or so, are you surprised by the giving here in Fayetteville?
Yes,
You
that's
are.
awesome.
I
Yeah.
mean, would you think that this community would give out as much as they're willing to or able to give, but based on its size, for example?
No. So it's actually, it is remarkable, it's heartwarming, and like I said, a great reminder of humanity. And I will say, Cumberland Community Foundation is a big part of that, especially with their Giving Tuesday campaign that we were fortunate to be a part of, along with 81 other nonprofits.
Yeah, and the start of this is actually February 1st and 7th. Is that when you pick up the meals? How does that work?
Yes, correct. So for that, meal pickups, you would call and place your order with the clinic. You can go online to do that as well, or the physical invites are going out shortly. Send that RSVP card back, and you pick the meal that you want, the date, and the time of pickup that you want.
And when all this is ended, the money will go to help you in your operation.
Yes.
And just give us an outline in terms of what type of things it would pay for, because it's hard to
Anything
imagine.
there, again, with no government funding, it's medications, pharmacies big there. Any other costs, literally, for other tools that we need, other supplies, anything along those lines.
You have folks who volunteer here. Where are these? Are they doctors, nurses?
Yes, anyone for the
physicians?
evening clinics or morning lab, or diabetic afternoon Tuesdays, all licensed volunteers.
And what do they say they get out of this? There's got to be some sense of community.
Of course, I mean, we also partner FSU. We have some people trying to get their hours that are required towards their certification, so we help them with that. Cape Fear, we have residents from Womack, and then other things outside of the clinic, like we mentioned briefly, newer partnerships with First Health of the Carolinas and their lung bus.
When you talk about people who are uninsured, they come from a variety of different walks of life.
Yes.
You see. To give us examples, we have this thing to this type of person.
It's all walks of life, all different ages, all situations in life. When we first moved down here about 3 years ago, I was briefly a patient there because I was working remotely, part-time. I had a bit of a health scare, so I was briefly a patient. So I know the true value in the services that we offer, especially if people don't really feel like they have somewhere else to turn.
I was talking to Johnny Wilson from Fayetteville Urban Ministry, and you probably work closely with him in some capacity. And one thing I've always said to him out of all the stories I've done when I was on television is I was always impressed with the way the staff interact with the clients. And I haven't done a story at the care clinic recently, but I'm sure it's the same type of temperament, that there's humanity and respect for folks who are in need when they come knocking on your door.
Yep.
Is that a good assessment of how you do what you do?
We try to offer hope, healing, and dignity to those that need it most in our community, and it's all about helping out our neighbors and seeing those neighbors that help us right back.
How much do you have like repeat visits from folks?
It all depends on what that is. The dental extractions, again, those are only basic ones. We don't handle wisdom teeth. Those are more obviously a one and done. For the most part, primary care, there's ongoing labs, follow-up appointments. It all depends on the situation.
And if I'm sure you got some referral type stuff too. Talk
Yep.
about that a little bit
Yep,
in case
clinic
somebody
or-
walks in there and
Yep, we can offer referrals for lab tests, x-rays, and other educational resources.
I think the problem for most people is the fact that they don't. A lot of folks just will not go to the doctor because of the expenses that are involved.
I think there's also a stigma too, and also like, what if something is really found, but you really don't know either where to turn or how to pay for it. So yes.
Well, I'll give you a perfect example. This just happened to me the other day, and Kenny and I were talking about it. I was in a kind of minor accident, but being 70 years old, I went to the doctor anyway, and they did a body scan, CAT scan, and all that stuff. And they said everything looks pretty good, but we've noticed some scarring on your lungs. And I guess that's the fear that you wanted to. Well, I knew exactly what that was. I was a COVID patient. I was in the hospital for 9 days, so I have long-term COVID. And here I am. That just a reminder, Baze, if you feel like you're out of breath sometime, it's because of COVID and the fact that you have that scarring on your lungs. And Kenny, you found out some things. Mary, I'm just going to bring you in for a second here. You found out some things about yourself as well, and when you went in and had a thing with your neck with your accident.
Yes, the MRI showed some things that, well, if I wouldn't have broken my neck, or let me say a mild fracture, I wouldn't have known. So yeah, you need to take care of yourself, and it's amazing what you find out. Once they do run a test of some kind, they say, oh, by the way, we want to look at this.
Yeah, that old by the way, by the way, what
Yeah.
is how you feel about it.
Yeah, so the MRI did show a few other things, but I'm not worried about it.
Yeah, and
My neck feels better, I'm out of the brace.
Nicole, you said you had a medical scan. I'm not going to ask you to divulge everything, but knowing you had a place to go, you say, well, at least I can try this.
Yes, it helped a lot.
Well, and not only for the medical condition, but just for the mental
Oh, peace of mind.
part of it.
Yeah.
Yeah, and I'm sure that happens for a lot of the folks that you see who come in and say, thank God
Yes.
that you're
sure.
here.
And then obviously, like I said, everything we do in-house and those referrals, but having the lung bus come to the clinic has really been remarkable. So we're working on setting up those dates for 2026.
Yeah.
They could detect early pea-size
right.
lung cancer.
We're going to run out of time here in a second, but I just want to make sure folks know why we're here and what we're doing and how they can get involved. You have the major sponsors now, or could you take another sponsor?
We have around 70 sponsors.
How many?
Around 70.
Wow!
So all different levels from $250 up to $5,000. So
And so the meal is $175. So someone paid $250, they get a meal.
you get that meal.
They get a
There's
meal
some
and a
other
ham.
perks. Yep.
Well, okay. So you can do it that way, or you can just
Flat
pay.
out buy. Yep. We're pretty much in terms of things going to print, the deadline's really passed for that. You could still sponsor, you just might not get that name on the invite going out.
Well, so and if you want to get involved and purchase a meal, the event is actually February 1st and February 7th.
Through February 7th. Yep.
So through the whole through that week.
Yep.
It's
correct.
a week.
Yep. You
Okay.
would pick your nighttime for either Luigi's or Dorothy's, or lunchtime for Luigi's pickup.
And is there a limit in terms of how many of these are going to be purchased?
For Luigi's, it's a limit on that time slot and each item. There's 10 per item per time slot, so you want to get those orders in early.
All right. And should they call the restaurant or call you?
Nope. Always call the clinic. So that would be a 910-485-0555, or you can go on our website to thecareclinic.org, and from there you could also directly go to our website to order your meal if you don't want to call the bus.
Okay, so all that stuff is going to go in, and we're pushing it. We did this right now before next year because we want to have you back again to remind folks.
Sure.
So sometime in mid-January, we'll get you back.
Perfect.
All right, Nicole Ryan with the Care Clinic. Always a pleasure to see you.
Thank you. Thank you for having me.
Oh. I was getting ready to say 4 because that was like the last time I saw you. It was a golf tournament going on here. All right, hey, we've got Fayetteville's most dependable forecast right now with CBS 17 meteorologist